Thank you for being so patient with me. So thank you, everyone. Hello, my name is Hayley Tait, and I am very excited to share with you my presentation on relational practice in public health, my learnings and reflections from Endocho Healing Society. So before I begin, I feel that it's important that I locate myself and detail to you how I come to this work. So I am a non-Indigenous Northerner. I was born and raised in Yellowknife Northwest Territories, home of the Yellowknife Dene First Nation, and this is where I'm coming to you from today. I was invited to work with Endocho Healing Society, and I'm mindful of my background, my biases, and my privilege, and how these influence the ways that I can work alongside Indigenous leadership in ways that are meaningful, respectful, and accountable. So to set the stage, I want to recognize the why behind the work of Endocho Healing Society. So across the Northwest Territories, there is a clear and urgent need for trauma healing, so much so that the territorial government mandated addressing the impacts of trauma as a priority for this current government assembly. The Northwest Territories is home to many Indigenous peoples whose lives continue to be shaped and impacted by residential schools and colonialism. However, despite the need, the Northwest Territories does not have in-territory trauma care, meaning that residents who wish to seek trauma-specific treatment are required to go south, often re-entering institutional environments that disconnect healing from culture, perpetuating the same colonial relationships that created this need for healing in the first place. So in response to this gap in territorial healthcare, Endocho Healing Society was created with a mission to establish the first in-territory residential or bed-based trauma healing lodge to support Indigenous residents as they navigate and heal from colonial trauma. So I was lucky enough to work with Endocho Healing Society for my practicum and to help support their vision of advancing Indigenous health and wellness in the Northwest Territories. So Endocho is still in the planning stages of this lodge, meaning that during my practicum and now, there is lots of work to be done to make the lodge a reality. So my practicum work primarily fell under three big themes or headings. The first is partnership and engagement. And under this theme, I was able to support tripartite working group discussions. So these were discussions between Endocho Healing Society, the federal government, and the territorial government. And I was also able to help draft material for federal, territorial, and Indigenous partners. Under the theme of strategic communication, I got to work on Endocho website content development, which was really fun. And I was also able to help draft internal resources and external documents like news releases and messaging. And then finally, funding opportunities was a big theme of my practicum, took up lots of my time, and I was able to help draft two major funding applications. The first was for the $1 million Arctic Inspiration Prize, and the second was a funding application through the Canadian Northern Economic Development Agency, or CanNor. And really, I was able to have this wide range of experiences primarily for two reasons. The first was because of the timing and the context in which this work took place. And the second is because of the small but mighty team at Endocho. So what is shaping this work? So the work at Endocho exists within a landscape of policies, priorities, and existing examples that influence how this work moves forward. So one of these is the Truth and Reconciliation Commission's call to action number 21, which calls the federal government to provide sustainable funding for new and existing Aboriginal healing centers. And it actually specifically names the funding for healing in the Northwest Territories and Nunavut as a priority. So Endocho is working to implement Call to Action 21, work that has been recognized both by the TRC and by the federal government since 2015 as a need. Nationally, we've seen some movement on Call to Action 21 through federal investments in Aquasariak. And Aquasariak is a trauma and addictions treatment center in Iqaluit, Nunavut. So its establishment is extremely relevant to the work that Endocho is doing, and it acts as a leading example of what can be achieved through coordinated government support, pointing to what's possible for trauma healing here in the Northwest Territories. At the territorial level, like I said previously, addressing the impacts of trauma is a mandated priority of the current government, which creates a really important window of readiness for this work to move forward territorially. At the same time, federal priorities have shifted under the new Canadian government, and a greater focus is being placed on economic growth, housing, and national security, which means that there's less of an emphasis on long-term investments in mental health and Indigenous wellness. That being said, within this context, moving the work forward is within reach, but it requires flexible and adaptive approaches. So an example of this is in spring 2025, Endicho secured $7 million for lodge construction through the Federal Green and Inclusive Communities Buildings Program, which is an example of looking beyond traditional health funding streams to move this work forward. So while the environment is shifting, work is still happening and moving forward, but it requires creative approaches to make that happen. So, because Endicho is such a small team, I want to take a moment to recognize the people leading this work. So, Roy and Jean Erasmus are chair and co-chair of the society, and they bring both lived and professional experience, as well as a long-standing commitment to Indigenous wellness in the North. Together, they co-founded a diploma counseling program specifically for Indigenous Northerners, and they initiated the vision and the mission behind Endicho Healing Society. Roy Erasmus Jr. is in the position of CEO, and Tait is in the position of project manager, and together they've both been central to moving the day-to-day work of the society forward. So you may recognize some repeating last names on this slide, and in this context, that's not unusual. It reflects how work often happens in the North, very close to the ground, where relationships are really closely connected and not separated from the work itself. So while this relationality might be unconventional within Western organizations and institutions, these relationships challenge the assumptions embedded in colonial administrative structures that prioritizes distance between professional and personal relationships. So this relational strength doesn't just stay within the team members at Endicho, but it also shapes how all of the work happens, both how the society operates day to day and how the lodge is being designed and constructed. So I believe this shows up in two key approaches. The first is two-eyed seeing, and the second is ethical space. So two-eyed seeing brings together knowledge from Indigenous and Western ways of knowing, and it recognizes that both offer something valuable. So at Endicho, this allows Western approaches to be integrated with Indigenous knowledges to provide trauma healing supports through the Trauma Healing Lodge and the development of the healing curriculum. Similarly, ethical space is about creating room for these different worldviews to exist together without one dominating the other. So in practice, this means holding space for both Indigenous and non-Indigenous perspectives and knowledges in ways that are respectful, balanced, and acknowledge respectful coexistence. So together, these two approaches shape both how Endicho understands trauma healing and how they're approaching the work needed to achieve it through the Trauma Healing Lodge. So how does this work move forward? In my eyes, it comes down to three big things. The first is sustainable funding. There needs to be adequate and sustainable funding allocated to trauma healing work in the Northwest Territories. Endicho can organize lodge planning and treatment delivery, but at the end of the day, there needs to be access to sustainable funds, not only to build the lodge, but also to operate and maintain it. Secondly is a shared responsibility. I came across an article that really spoke to me that used the metaphor of basket and copper pot work to represent the work of Indigenous and non-Indigenous organizations. So basket work refers to the efforts to promote cultural continuity, grounded in unique and distinct knowledges and advanced by Indigenous people, so Indigenous-led work, whereas copper pot work is the responsibility of governments and institutions to address the systemic barriers and provide the support needed for Indigenous-led work to happen. So Endicho is working to advance the basket side of this trauma healing work, but we need federal and territorial governments to advance their copper pot responsibilities in parallel. And lastly, our partnerships. We know that what we're working towards is achievable. Aquasariac, the recovery center in Nunavut, is a strong example that trauma healing can be achieved through coordinated federal and territorial investments and partnerships. So a pathway exists, and it's now about negotiating the same level of coordinated investments for trauma healing in the Northwest Territories and fully implementing call to action number 21. So as I wrap up, I would just like to say I'm really grateful for the opportunity and the experience to work with Endicho Healing Society. Being a part of this work, even in a small way, has felt really significant and has really pushed me to think differently about how change happens and what it takes to move change forward in the North. I found lots of meaning in this experience, and I'm grateful to have contributed to something that can and will shape Northern health and healing for generations. Lastly, I'd just like to give a big merci to Roy and Gina Erasmus, Roy Erasmus Jr., and Leanne Tait for inviting me to take part in this work. There is tremendous value in this work, and I'm eager to see the development of the Trauma Healing Lodge and its impact on the health of individuals, families, and communities. Thank you so much.